Now that I've revealed that fasting insulin is the number one way I help people figure out why they are gaining weight and not losing, everyone's asking, well, how do you treat it? Let's take a minute for a quick physiology lesson. When you eat a carbohydrate, it breaks down into sugar, and your pancreas releases insulin in response and wraps around that sugar and takes it off to your body. Insulin resistance is when your body starts saying, oh no, you know what? That blood sugar has been getting too high and we don't like that level of insulin. We're not going to respond to it. So pancreas, can you make more insulin? And so your body secretes more insulin. In this time period, the blood sugars keep rising. And the problem with rising insulin is that insulin is a fat storage and hunger hormone when it's produced in excess. So the same body that was giving signals back to being insulin resistant only puts on more weight, which complicates and worsens insulin resistance. So now that we know that insulin is secreted in response to carbohydrates, we have our answer. So the number one way that we treat insulin resistance is to change our diet. Now, for many people, they'll find great success with limiting carbohydrates down to 20 grams or less. And this is a diet that is called a ketogenic diet. Now, it doesn't need to be this extreme for everyone, but once you find that you have a insulin resistance, you need to have some form of carbohydrate restriction. And for many people, that can look like 100 grams of carbohydrates or less a day. But really, we just need to make a significant difference from where we started and to where we're going. The second thing that can help many people in terms of dietary modification and reducing insulin resistance is fasting. So if you're not eating, you can't possibly be seeing any carbohydrates, and it gives your body and your pancreas time to rest. At minimum, I want all of my patients with insulin resistance fasting for at least 12 hours, and that can just be overnight. Now, many people will find success in extending this. The only caveat is that fasting does not benefit you if you don't have your meals planned for when you break your fast, and it leads to binging or eating food that isn't in line with reduced carbohydrates. Check out part 2, where we'll be talking about lifestyle modification beyond diet for the treatment of insulin resistance.